Welcome to the deep dive. Today, we're diving into the world of optometry.
Oh, exciting.
Yeah, it's way more fascinating than you might think, I promise.
Than just like eye charts and glasses.
Exactly. We got a ton of sources from you guys, encyclopedia entries, articles, even some firsthand accounts from optometrists themselves.
Sounds like a good mix.
It is. And, our mission is to really dig into this stuff, find the most interesting and important bits about what optometrists really do.
I think a lot of people would be surprised. It's a field that's often misunderstood, right?
Yeah, for sure. Like, I always thought, you go to the optometrist for new glasses, maybe contacts.
Right, just the basics.
Yeah, some of these sources are saying optometrists are managing conditions like glaucoma. I always thought that was strictly for ophthalmologists.
Yeah, that's a common misconception. And it is interesting how those lines are getting a little blurry in some areas.
Totally. But before we get too deep into that, maybe let's just start with, what exactly is optometrist?
$1 million question. What do you think?
I mean, most people would probably say they're the ones who, check your vision.
Right, the eye chart people.
But these sources are suggesting it's way more than that.
Oh, absolutely. The World Council of Optometry, they define an optometrist as a primary healthcare practitioner for the eye and visual system.
So like the general practitioner, but just for your eyes.
Exactly. So they're trained to diagnose, treat, and manage all sorts of eye conditions.
Okay, I'm starting to see the bigger picture here. But then where do ophthalmologists fit in? I got to admit, I always get those two mixed up.
Yeah, it's easy to do. The key difference is that ophthalmologists are medical doctors, right? They specialize specifically in eye surgery.
So if you need ASIC or a cataract surgery, you go to the ophthalmologist.
Exactly. Optometrists, on the other hand, they're focused on the comprehensive eye care stuff. So that's your regular checkups, prescribing glasses and contacts, managing conditions with medication.
Okay, so they're the ones you see for the everyday eye stuff.
Yeah, pretty much.
Gotcha. Now, what about opticians? Are they the ones who actually make the glasses?
They are. They're like the pharmacists of the eye care world, you could say.
So they take the prescription from the optometrist or the ophthalmologist.
Right.
And then they help you actually pick out the right lenses, the right frame.
Exactly. And they make sure everything fits properly, adjust them if they need to.
Okay. So they're the ones who save me from those awful headaches from glasses that don't fit right.
They're the heroes we need.
Totally. Speaking of prescriptions, though, one thing that kind of surprised me reading these sources, it said optometrists can actually prescribe medications.
Yeah.
Is that a new thing?
Well, it's not exactly brand new, but the scope of what they can prescribe, that really depends on where they're practicing.
Oh, so it's different state by state.
Yeah, it could be different state by state. In some places, they can prescribe antibiotics for eye infections, stuff like that. In other places, they might have to work with an ophthalmologist to manage certain conditions.
So it's not like a one-size-fits-all profession, I guess.
Right.
So what about the training to become an optometrist? What does that actually look like?
So get this, in the U.S., optometry school is a postgraduate program.
Wait, really?
Yeah. So that means after your 4 years of college, you got to do another 4 years at an accredited optometry school to get your Doctor of Optometry degree.
A Doctor of Optometry. Wow. That's a lot of school.
Yeah.
Makes you wonder what they could possibly be studying for all those years. Can't just be eye charts, right?
No, definitely not. They get deep into the anatomy and physiology of the eye. They learn about a ton of different eye diseases, the treatments, and they get tons of hands-on experience in clinical settings.
So they're not just learning the theory, they're actually getting out there and doing it.
Exactly. It's a super comprehensive education covering everything from optics and pharmacology to neurology.
Wow. It really makes sense now why they can spot those tiny details that most of us would just completely miss.
Yeah, they're trained to see things we don't even know to look for.
That's incredible.
Yeah.
But even after all that schooling, are they ready to go? Or is there more?
So before they can actually practice, they have to pass these really tough national board exams.
Oh, right, of course. Makes sense.
And they need to get licensed in the state where they want to practice.
I bet that's no walk in the park.
Nope. And some optometrists even choose to do a residency after all of that.
A residency? Like doctors do?
Yeah, it lets them specialize in a certain area, like pediatrics or low vision.
So even after becoming an optometrist, they can keep learning and specializing.
Exactly. Always something new to learn.
So after all that rigorous training, what can an optometrist actually do for you? What's the scope of what they can handle? It sounds way more than I initially thought.
It is. I mean, they definitely do comprehensive eye exams, but it goes way deeper than just checking your vision with an eye chart.
Okay, that's what I was thinking. So it's more than just, can you read line 5?
Right. They're also looking for clues about your overall health, too.
Wait, really? What kind of clues can they get from just looking at your eyes?
Oh, a lot. You know how they do that puff of air test?
Yeah, to check the eye pressure, right?
Yep. That's checking for glaucoma. It's a tricky condition that can sneak up on you, and you might not even notice until it's too late.
Okay, so that's one thing. What else are they looking for?
They're also checking out the blood vessels at the back of your eye. Any changes there could be early signs of diabetes, even multiple sclerosis.
Whoa, I had no idea. It's like they're medical detectives using our eyes as a window into our whole body.
Exactly. Pretty cool, right?
That makes regular eye exams seem even more important than I thought.
They are. It's about so much more than just seeing clearly. It's about prevention and early detection of all kinds of things.
That's amazing. So let's dive into some of the cool tools and tests optometrists use. What kind of technology are we talking about?
Oh, there's some really cool stuff. Besides that air puff test for glaucoma, they might use something called a keratometer.
Keratometer, what's that do?
It measures the curvature of your cornea. It's super important for fitting contact lenses.
So make sure your contacts actually fit right.
Exactly. And then, to get a really good look at the back of your eye, they might dilate your pupils.
Oh yeah, I've had that done before. Makes everything super blurry for a while.
It does. But that's how they can check for signs of diseases like macular degeneration. That one affects your central vision.
It's incredible how much they can tell just by looking into your eyes.
It is. The eye really is a window to the body. And they're trained to see what we can't.
So they can actually diagnose and treat a whole range of conditions too, right?
Yeah.
Not just vision problems.
Right. They handle all the common stuff like myopia, nearsightedness, astigmatism, prescribing glasses or contacts to fix those. They can diagnose and treat eye infections, dry eye, even some more serious conditions like glaucoma, depending on where they practice, of course.
That's pretty impressive.
Yeah.
One thing that really stood out to me from these sources, though, was that optometrists aren't just working in those private practices anymore.
Oh, yeah. What else are they doing?
Well, it sounds like they're showing up in hospitals, public health initiatives, even research labs. Like, their reach is expanding way beyond what I thought.
It's true. Their role is definitely evolving beyond that traditional clinic setting. It's pretty exciting to see. For instance, you'll find optometrists in hospital eye clinics now.
Oh, wow. Doing what there?
Well, they can provide specialized care like low vision rehabilitation for people with visual impairments.
Makes sense.
And they're collaborating more and more with other specialists to manage those complex cases that might involve both eye health and other systemic conditions.
Oh, that's interesting. So they're becoming more integrated into the whole healthcare system.
Exactly. And it makes sense considering that connection between eye health and overall health we were talking about earlier.
Right. Because they can often be the first ones to spot signs of other diseases just from looking at your eyes.
Absolutely. They're like frontline detectors for things like diabetes, high blood pressure, even autoimmune disorders.
Wait, seriously?
Yeah.
Just from looking at the eyes, what are they seeing that can tell them all that?
Well, for example, in people with diabetes, high blood sugar can actually damage the tiny blood vessels in the retina.
Oh, wow.
And that leads to a condition called diabetic retinopathy. Optometrists, they can see those changes during an exam and refer the patient to their doctor.
So it's like an early warning system.
Exactly. It can make a huge difference in getting people the treatment they need early on.
That's incredible. Really highlights the importance of those regular eye exams, doesn't it?
For sure. And speaking of eye exams, optometrists are also involved in global initiatives like Vision 2020.
Vision 2020. I've heard of that, but what is it exactly?
It's a huge effort to eliminate preventable blindness worldwide.
Wow, that's amazing. I didn't realize optometrists were playing a role in something that big.
Oh, yeah. They're a key part of it. So yeah, the field of optometry is definitely expanding its horizons. Now, these sources also mention something about optometry being practiced differently around the world.
Yeah, I was curious about that too. What kind of differences are we talking about?
Well, the scope of practice, the education requirements, even the specific services they offer, it can all vary quite a bit from country to country.
So what an optometrist can do in one country might be totally different in another.
Exactly. For instance, in the UK, optometrists can prescribe a much wider range of medications than they can in the US.
Wow, really?
Yeah, including some oral medications. But then in countries like India, there's a huge shortage of trained optometrists. So that creates a whole different set of challenges for providing eye care to their population.
It's interesting how the profession adapts to different needs and healthcare systems around the world, isn't it?
It is. It's not a one-size-fits-all kind of thing. Now, switching gears a bit, one of the things that really caught my eye, no pun intended, was the impact of technology on optometry.
Ah, yeah. Telehealth, artificial intelligence, all that stuff.
Right. It seems like things are changing so rapidly.
It's a little mind-blowing to think about. So telehealth, for example, is already making eye care more accessible, right? Especially for people in rural areas or who have trouble getting around.
Exactly. Imagine being able to do a preliminary eye exam right from your own home using your phone or computer.
That would be incredible.
Yeah.
Wouldn't that compromise the quality of care? Can a virtual exam really replace an in-person visit?
Well, it's not meant to fully replace in-person exams, but it's more like a way to complement them.
Okay, I see.
Telehealth is super useful for follow-up appointments, medication management, or even just initial screenings to see if you actually need a full in-person exam.
So it's like a triage system, making sure people get the right level of care at the right time.
Exactly. It can really streamline things and make care more efficient. Now, what about AI? You're seeing that popping up everywhere in healthcare.
Yeah, it's a little overwhelming, to be honest.
I know, but it's showing huge promise in areas like image analysis and disease detection. For example, they have algorithms now that can analyze retinal images.
What do you mean?
Like, they can analyze the images and flag potential signs of things like diabetic retinopathy or macular degeneration, even before those signs are visible to the human eye.
Well, hold on. The AI can see things that the optometrist can't.
Well, it's more like they work together. The AI is like a second set of super-powered eyes, constantly on the lookout for anything unusual.
That's wild. So does that mean robots are going to replace optometrists in the future?
Not at all. These technologies are really just tools. They're there to enhance the optometrist's skills, not replace them.
That's reassuring.
Yeah. AI can actually free up more of the optometrist's time to focus on the things that need that human touch, like complex cases, patient education, building those relationships.
That makes a lot of sense. It's not about technology taking over. It's about humans and machines working together to provide the best care possible.
Exactly. It's a collaboration.
And it's important to remember that human connection is still so crucial in healthcare. Like, you can't replace the empathy, the communication skills, that judgment that optometrists bring to the table.
You're absolutely right. A good optometrist isn't just a technician, they're a partner in their patient's eye health journey.
Well said. It sounds like the future of optometry is bright, but also pretty complex with all these advancements and evolving roles. So for someone listening who might be considering a career in optometry, what would you say are the most important qualities to have?
That's a great question. I think first and foremost, a good optometrist needs to be a skilled clinician.
Makes sense.
They got to have that deep understanding of the eye and visual system. But beyond that, they have to be excellent communicators, be able to explain things clearly, listen to their patients' concerns, and make people feel comfortable asking questions.
So it's not just about the technical knowledge, it's about those people skills too.
It's about the whole package. A good optometrist is not just there to fix your vision, they're there to help you live life to the fullest.
I love that. Now, before we wrap up, I got to ask, any predictions about what's coming next in optometry? What kind of wild advancements might be on the horizon?
Ooh, that's a fun one. Well, all the advancements we've talked about, telehealth and AI, they're just the tip of the iceberg.
So there's more.
Oh, yeah. Imagine personalized gene therapies for eye diseases or even bioengineered eye tissues to replace damaged ones. It sounds like science fiction, but it could be reality someday.
It's mind-blowing to think about. It really makes you wonder, what seems impossible today might be commonplace tomorrow. Thinking about all these potential advancements and the changing role of optometry, what's the one big question you want to leave our listeners with today?
I think connecting this to the bigger picture, it raises an important question, like how will all these advancements impact access to eye care around the world?
Oh, that's a good one.
Will technology help to bridge the gap in those underserved areas, or could it actually make existing inequalities worse?
Yeah, that's a crucial point to consider. It's easy to get caught up in the excitement of new technology, but we have to make sure its benefits are accessible to everyone, not just a select few.
Exactly. The future of optometry isn't just about groundbreaking technology, it's about ensuring everyone has the chance to see clearly and live a life without preventable vision loss.
Well said. This deep dive has been a real eye-opener for me. I had no idea how much optometry encompassed, from the science and technology to the global impact and the connection to our overall health.
It's been a fascinating exploration, hasn't it? And this is really just the beginning. If anyone listening wants to learn more about optometry, whether it's for a potential career or just out of curiosity, there's a whole world of information out there to explore.
So keep learning, keep those eyes healthy, and thanks for joining us on this deep dive into the world of optometry.
Until next time. And they might use a special camera to take pictures of the back of your eye.
Oh, like to get a closer look.
Exactly. It helps them check for any signs of damage or disease.
Like macular degeneration.
Exactly. It can really affect your central vision.
Makes sense. So they can diagnose and treat a whole bunch of conditions, right?
Oh, yeah. They handle common vision problems like myopia.
Nearsightedness.
Right. Astigmatism, too.
So prescribing glasses and contacts for those.
Exactly. They can also diagnose and treat eye infections.
Like pink eye and stuff.
Yep. Dry eye.
That's a common one.
It is. And even some more serious conditions like glaucoma.
But that depends on where they practice, right? We talked about that.
Exactly. It varies from place to place.
One thing that really stood out to me, though,
What's that?
it seems like optometrists aren't just working in private practices anymore.
Oh, definitely not. They're branching out in so many ways.
Yeah. The sources mentioned hospitals, public health initiatives, even research labs. It's like their reach is expanding beyond what I ever imagined.
You're right. It's pretty fascinating to see how their role is evolving.
Yeah. Like, tell me more about that. What are they doing in hospitals?
Well, for one, you'll find them in those hospital eye clinics,
Okay.
providing specialized care.
Like what?
Things like low vision rehabilitation.
For people who are visually impaired.
Exactly. They help people adapt to vision loss and maximize their remaining vision.
That's amazing. So they're not just about fixing perfect vision. They're helping people who have already lost some of their sight.
Exactly. It's about helping people see the best they can, whatever their situation.
I love that. So what about collaborating with other specialists?
Oh, yeah, that's happening more and more, too.
Makes sense, especially with that connection between eye health and overall health we talked about.
Right. Optometrists are often the first to notice those signs of other health problems just from looking at your eyes.
Yeah, we were talking about that earlier. It's amazing.
It is. They can be like early warning systems.
So they're not just focused on the eyes themselves, they're looking at the whole picture.
Exactly. They see the eyes as part of a larger system connected to everything else.
That's a really holistic approach. I like that.
It's so important. Now, remember we were talking about Vision 2020?
Yeah, the global initiative to eliminate preventable blindness.
That's the one. Optometrists are a big part of that effort, too.
So they're really making a difference on a global scale.
Absolutely. Their impact goes far beyond the exam room.
That's inspiring. Now, the sources also mentioned that optometry is practiced differently around the world.
Oh, yeah, definitely.
Like, what are some of the key differences?
Well, the scope of practice vary a lot.
Meaning what they're actually allowed to do.
Exactly. The education requirements are different, too.
Oh, of course.
And even the types of services they provide can vary.
Wow, so it's not a one-size-fits-all profession at all.
Nope. It really depends on where you are in the world.
So give me an example. What's something that's different in another country?
Well, in the UK, for instance, optometrists can prescribe a much wider range of medications than they can in the US.
Like a lot more.
Yeah. They can even prescribe some oral medications.
Wow, I didn't realize it was that different.
It is. And then you have countries like India, where there's a huge shortage of trained optometrists.
Oh, right. I remember reading about that.
It makes it really challenging to provide adequate eye care to such a large population.
That's a whole different set of challenges.
It is. So you can see the profession really adapts to the specific needs and healthcare systems of each country.
It's fascinating how diverse it is. Now, I got to ask you about technology because that was something that really caught my attention.
Oh, yeah. Technology is changing everything in optometry.
It's kind of mind-blowing to think about.
I know. It's amazing how fast things are evolving.
Like telehealth, for example. That's already making eye care more accessible, right?
Absolutely. Especially for people in rural areas or those who have trouble getting to appointments.
Makes sense.
Imagine being able to have a preliminary eye exam right from your own home.
Using your computer or phone.
Exactly.
That sounds incredible. But wouldn't that compromise the quality of care? Can a virtual exam really replace a visit to the optometrist?
Well, it's not meant to completely replace in-person exams.
Okay.
It's more about complementing them.
I see.
Telehealth is really useful for follow-up appointments.
So you don't always have to go in person.
Right. It's good for medication management, too.
Oh, that's convenient.
And it can even be used for initial screenings.
To see if you even need a full exam.
Exactly. It helps to triage patients and make sure they're getting the right level of care.
So it's all about efficiency and making sure people get the care they need when they need it.
Exactly. Now, what about AI? You're seeing that pop up everywhere in healthcare these days.
It's a little overwhelming, to be honest.
I know, it's a lot. But it's showing a lot of promise in optometry, too.
Oh, yeah? Like how?
Well, it's really good at things like image analysis and disease detection.
What do you mean?
For instance, there are algorithms now that can analyze images of the retina,
Okay.
and they can flag any potential signs of disease like diabetic retinopathy or macular degeneration.
Wait, the AI can see things that the optometrist might miss?
Well, it's more like they work together.
Okay.
The AI is like a second set of eyes, constantly scanning for anything unusual.
That's pretty amazing.
It is. But don't worry, robots aren't taking over just yet.
Phew, that's good to hear.
These technologies are really just tools to help optometrists do their jobs even better.
They're not replacements?
Nope. In fact, AI can actually free up more of the optometrist's time
To do what?
to focus on those things that require human expertise, like those complex cases, patient education, building relationships.
That makes sense. It's about finding the right balance between technology and the human touch.
Exactly. It's a collaboration.
And that human connection is so important in healthcare.
You're absolutely right. You can't replace empathy, communication skills, and good judgment.
Those are things that only humans can provide.
And that's what makes a good optometrist so valuable.
So it's not just about the technical skills. It's about being a good communicator and building trust with patients.
Exactly. A good optometrist is a partner in their patient's eye health journey.
I love that. It sounds like the future of optometry is both bright and complex, with all these advancements and evolving roles.
It's a really exciting time to be in the field.
So for someone listening who might be thinking about a career in optometry, what would you say are the most important qualities to have?
That's a great question. First and foremost, a good optometrist needs to be a skilled clinician.
Okay, that makes sense.
They need that deep understanding of the eye and how it works.
Yeah.
But beyond that, they have to be excellent communicators.
The human touch again.
Exactly. Being able to explain things clearly, listen to their patients, and make them feel comfortable asking questions, that's crucial.
So it's not just about the science, it's about connecting with people.
Absolutely. A good optometrist isn't just fixing your vision, they're helping you live a healthier, happier life.
That's a great way to put it. Now, before we wrap up, I have to ask, what are your predictions for the future of optometry? What kind of wild advancements are on the horizon?
Ooh, that's a fun one to think about. Well, all the advancements we've talked about, like telehealth and AI, those are just the beginning.
Wait, there's more?
Oh yeah. Imagine personalized gene therapies for eye diseases, or even bioengineered eye tissues to replace damaged ones.
That sounds like science fiction.
I know. It's incredible to think about what might be possible in the future.
It really is. It makes you wonder, what seems impossible today could be reality tomorrow?
Exactly. The possibilities are endless.
Thinking about all these potential advancements and the changing role of optometry, what's the one big question you'd want to leave our listeners with today?
Well, thinking about all that, yeah, it raises a really important question. How are all these advancements going to affect access to eye care globally?
Oh yeah, that's a big one.
Will technology help bridge the gap in those underserved areas, or could it actually, make those inequalities worse?
Yeah, that's a crucial thing to think about for sure. It's easy to get caught up in the excitement of all this cool new tech, but we got to make sure everyone benefits, not just a lucky few.
Exactly. The future of optometry isn't just about, amazing technology. It's about making sure that everyone everywhere has a chance to see clearly and live a life without, preventable vision loss.
Well said. This whole deep dive has been a real eye-opener for me. I had no idea how much optometry covered, from all the science and tech to the global impact and how it connects to our overall health. It's incredible.
It's been a fascinating journey, for sure. And remember, this is really just the starting point. If anyone listening is thinking about a career in optometry or wants to learn more about a specific eye condition, or just wants to know more about the world of eye care in general, there's a ton of information out there just waiting to be discovered.
So keep learning, keep those eyes healthy, and thanks for joining us on this deep dive into the world of optometry.
Until next time.